So fat grafting is very interesting because it is a beautiful treatment because it's very natural. It's your own tissue, so it's something that really feels comfortable to people to have done. But there are drawbacks to it. It's a little bit unpredictable, and here's why. Fat grafting is a live tissue graft, so we are taking fat from one area of your body and we're putting it into a new place. In order for that fat cell to survive, it has to get oxygen from blood supply. So it gets layered into your normal tissue and then the blood supply will grow into it, just like any skin graft or any other kind of tissue graft will work. So if I put kind of a gob of fat in like that, like to fill in a whole cheek, the part on the outside will get vascularized because that's the portion that's in contact with the rest of your tissues. But everything in the center, if it's not in contact and is not able to get blood supply, it will not survive and will eventually your body will just reabsorb it. So when we put fat grafts in, we have to put little single layer aliquots essentially of fat so that it's in contact with other tissue so it could get vascularized. No matter whatever fat we put in, we know that a portion of it is going to not survive and become reabsorbed. That's the part that's unpredictable. In some people, they'll have a 30% take of their fat graft. Some people will have 50% take. It's very unusual to have 100% take of your fat grafts, but I always err on the side of caution because I don't want to overtreat somebody with fat and have them be that one person who gets 100% take and looks swollen and terrible, because once we put the fat in there, it is irreversible. So I do caution people who are coming for facial revolumization using fat grafting that we are going to have to come back multiple times to build up to that optimal result so that we don't overdo it in one treatment, and we're just really careful with it. But once it's done and the graft is there, it's going to be permanent and you're not going to have to keep coming back for other procedures. I can tell you that in my hands, most of my patients who are having fat grafting procedures are having it done during their facelift procedure, and then oftentimes they'll get a good 50% of that graft to take, and then they come back and they do their maintenance treatments with hyaluronic acid fillers and things like that just to keep things up with the volume replacement. So we can combine it anyway, and we certainly can tailor that to any patient's whatever is most comfortable for their budget and what they want to do as far as putting commercial fillers in their face versus their own natural tissue.